Let's talk about something that seems simple but actually carries more confusion than almost any other part of Medicare, Part A. The part that most people assume is just hospital coverage, but once you dig into it, there's so much more going on beneath the surface. And as we move into 2026, there are a few key updates that make it even more important to understand exactly what Part A does, what it doesn't do, and how it fits into your bigger Medicare picture, especially if you're thinking about hospital costs, skilled nursing, or even planning for that unexpected stay nobody ever wants but everyone needs to prepare for. Now, I want you to imagine this. You've just turned 65. You did everything right, you worked all those years, paid your Medicare taxes, and finally get your red, white, and blue card in the mail. You flip it over, see Part A and Part B, and feel a small sense of relief. Okay, you think, at least I have hospital coverage. But a few months later, your friend goes into the hospital, gets a bill for thousands of dollars, and says, "I thought Medicare paid for everything." That's when it hits you, nobody really told you where the line ends. So let's walk through this in a calm, real way. Medicare Part A is the part of your coverage that helps pay for inpatient hospital stays. Think of it as your safety net when you're admitted to the hospital, a skilled nursing facility, or even, in some cases, hospice care or limited home health services. If you paid into Medicare for at least 10 years, or your spouse did, you don't pay a premium for it. That's why it's sometimes called premium-free Part A. But that doesn't mean it's free when you use it. Let's take an example. Meet Carol. She's 68, lives in Michigan, and had to have knee surgery last spring. Her surgery went great, but she needed to stay in the hospital for 4 nights. Her Part A covered the hospital room, meals, nursing services, and the medical supplies she needed. But when the bill came, she saw a $1,632 deductible. That's the 2024 rate, and in 2026, it's projected to go up again, likely in the range of $1,700 to $1,800 for each benefit period. So even though Carol didn't pay a premium, she still had an out-of-pocket cost the first time she was admitted that year. And that term, benefit period, is one of those phrases that trips everyone up. A benefit period starts the day you're admitted to the hospital and ends when you haven't received inpatient care for 60 days in a row. If you're admitted again after those 60 days, you start a new benefit period, which means a new deductible all over again. That's one of those details most people only learn the hard way. Now here's something that often surprises people: Part A doesn't just cover hospital stays. It also helps with skilled nursing facility care, but only after a qualifying 3-day inpatient hospital stay. So let's say Carol's knee surgery required physical therapy afterward. If her doctor said she needed to recover in a skilled nursing facility for, say, 2 weeks, Part A would help cover that. But only because she was first admitted to the hospital for at least 3 days. If she had been kept under observation status instead, which many hospitals now do, she wouldn't qualify. That small difference in wording between inpatient and observation can cost thousands of dollars. In 2026, CMS is expected to tighten rules around hospital classification because so many seniors have been caught off guard by that observation loophole. The push is toward clearer notice requirements, meaning hospitals will need to tell you in writing whether you're inpatient or observation before your discharge. It's one of those quiet changes that could make a big difference for people like Carol, who might otherwise get blindsided when they move to rehab and find out Medicare won't cover it. Let's take another example. Robert, 73, from Ohio, had pneumonia last year. He spent 5 nights in the hospital and then went to a skilled nursing facility for 10 days to get back his strength. His Part A covered the first 20 days of that facility care in full, just like the rules say. But if he had stayed longer than that, he'd have been responsible for a daily coinsurance amount, about $200 a day in 2024, expected to be around $220 in 2026. After 100 days, Medicare stops paying altogether. That's one of the biggest shocks people face when they think skilled nursing means long-term care. It doesn't. Part A covers recovery, not ongoing living support. So if you're planning ahead for 2026, that's something to keep in mind. Medicare Part A will help with the short-term skilled care after a hospital stay, but it won't pay for long-term custodial care, like living in a nursing home full-time. That's where people either pay out of pocket, use long-term care insurance, or qualify for Medicaid. Now, what about hospice care? This is one area where Part A truly shines. If you're diagnosed with a terminal illness and choose to focus on comfort rather than curative treatment, Part A steps in to cover hospice care, medications, pain relief, counseling, and support for both the patient and their family. It's one of the most compassionate benefits in Medicare, and it's available in all 50 states, regardless of income. Hospice care can be provided in your home, in a facility, or in a hospice center, and in 2026, CMS is adding stronger quality oversight to ensure those services are consistent nationwide. There's also a small but important piece of coverage under Part A for home health care. This isn't full-time nursing, it's for situations where you might need intermittent skilled nursing or physical therapy at home after a hospital stay. Part A helps pay for it if your doctor certifies it as medically necessary. Now, let's talk about what you pay, because even though Part A is often premium-free, the costs can still surprise people. In 2026, if you or your spouse haven't worked enough to qualify for premium-free coverage, the monthly cost for Part A is expected to hover around $560, up slightly from 2025's rate. Most people don't fall into that category, but it's worth knowing. For most Americans, the real cost of Part A shows up when you use it: the deductibles, co-insurance for extended stays, and the out-of-pocket limits that never truly cap out. Unlike a Medicare Advantage plan, Original Medicare, including Part A, doesn't have an annual out-of-pocket maximum. That's why many people pair it with Medigap, to fill those financial holes. Speaking of Medigap, it's worth noting how closely it ties into Part A. When you buy a Medigap policy, one of the first things it covers is that big Part A deductible. So instead of paying it yourself each benefit period, your supplement picks it up for you. Some Medigap plans also cover the additional hospital co-insurance days and even add up to 365 extra lifetime hospital days beyond what Medicare covers. For someone with a long recovery or recurring hospital needs, that's invaluable. Now let's look at how this connects to Medicare Advantage, because a lot of people ask, if I have a Medicare Advantage plan, do I still get Part A? The answer is yes. Even when you join a Medicare Advantage plan, Part C, your coverage always includes Part A and Part B, they're just managed by a private insurer. In fact, in 2026, Advantage plans will continue to include all standard Part A benefits, but they'll also layer on more extras, like dental, vision, and even expanded transportation coverage for hospital discharges. One of the big 2026 updates involves how dental coverage will coordinate with inpatient care. Let's say you're admitted for a heart procedure, and your doctor says you need a dental clearance first. In the past, Medicare wouldn't pay a dime for that dental exam. But new 2026 Advantage plan structures are adding inpatient-related dental benefits, so if the dental care is medically necessary for your hospital treatment, some plans will now help cover it. That's a big shift in integrated care. And here's something you might not know: hospital readmission rates are one of Medicare's most closely tracked metrics. In 2026, CMS is expanding its hospital readmissions reduction program to include new conditions and more hospital accountability. That means your Part A hospital experience could actually get smoother because hospitals have more incentive to make sure you're truly ready to go home and stay home. Let's get back to the everyday side of this. When you're admitted to the hospital, Part A covers your room, your meals, general nursing, drugs you receive as part of inpatient treatment, and any other hospital services you need. But it doesn't cover private rooms unless they're medically necessary, it doesn't cover personal items like a TV or phone, and it doesn't cover your doctor's visits. That's Part B. So even one hospital stay often involves both Parts A and B working together. For example, if Carol's surgeon comes in to check on her during her stay, the hospital stay is billed under Part A, but the surgeon's professional fee is billed under Part B. It's all part of that complex but tightly linked system Medicare has built over the years. Another real-world scenario, let's say your parent is in the hospital for a hip replacement. After discharge, they go home but need a few weeks of physical therapy. If that therapy happens in a facility, it's covered under Part A as skilled care, after a qualifying inpatient stay. If it happens at home, it might be billed under Part A or Part B, depending on how it's structured. The point is, Part A always starts the coverage chain for inpatient care and recovery. Now let's look at something that's often overlooked: how Part A affects your taxes. When you work, a portion of every paycheck goes toward Medicare through the hospital insurance tax, which funds Part A. Even if you're self-employed, you've been paying into it. That's why you're eligible at 65. It's one of those benefits you've already earned, not something you're asking for. For those who continue working past 65, especially in 2026 as retirement ages keep shifting, you can delay signing up for Part B if you have employer coverage, but Part A is usually automatic and still free. Some people choose to delay even Part A if they're contributing to a health savings account, because once you enroll in any part of Medicare, you can't contribute to an HSA anymore. That's one of those strategic timing decisions people need to know about before they retire. Another small but important change coming in 2026 is the modernization of how Medicare tracks hospital benefit periods. CMS is working to make the tracking more transparent, using updated digital systems to help patients and providers know exactly when a benefit period starts and ends. This means fewer billing errors and less confusion about whether a new deductible applies. Now, what happens if you're admitted to the hospital multiple times in 1 year? You could face that deductible more than once, depending on the timing. That's another reason Medigap plans are so popular. They help smooth out those unpredictable costs. In fact, the majority of people who stick with original Medicare choose to add a Medigap plan primarily because of Part A expenses. So, if we step back and look at the big picture for 2026, here's what's changing around Medicare Part A: modest increases in deductibles and coinsurance, stronger transparency around hospital admission status, better coordination for inpatient-related dental and care transitions, and continued modernization of how hospital coverage is managed behind the scenes. But what's staying the same is the heart of what Part A is: your foundational hospital insurance. The safety net you've earned through a lifetime of work. Every time I talk with someone who's just joined Medicare, they always say the same thing: I wish I'd learned this sooner. Because understanding what's covered and what's not gives you control. It helps you plan. It helps you avoid those surprise bills and make smart decisions about supplements or advantage plans. So whether you're turning 65 this year, planning ahead for 2026, or helping a parent navigate their hospital bills, remember this: Medicare Part A is not just a government program. It's protection for some of life's most vulnerable moments. And understanding it fully is the first step in protecting yourself. If this helped make things clearer, comment your name and state below. I'd love to see who's watching and benefiting from these videos. And if you want to stay ahead of all the Medicare changes coming in 2026, from dental coverage expansions to new cost rules, make sure you're subscribed, because we break it all down here, calmly, clearly, and in plain English.